Canadian headquartered bioLytical Laboratories has opened an office in South Africa to provide rapid, reliable home testing for HIV and other STIs. The company's overarching philosophy, it says, is to empower clinicians and the public at large to make informed, quicker health decisions through its range of one-minute tests that provide instant, accurate results for infectious diseases. This would include COVID-19, HIV, hepatitis C, and syphilis, among others. I'm in conversation now with Hans Croukamp, who is bioLytical Laboratories' Chief Operating Officer. Hans, a very warm welcome to you. First of all, for the benefit of the South African market, can you give us some background to the company, please?
Definitely. Good morning, Jeremy. We've been in business since the late 1990s. Started where this all started at UBC. A company was formulated in the early 2000s and got involved in the HIV market. At that stage, it was a huge growing concern to get people tested as rapidly as possible with the highest accuracy, and of course speed was a huge concern at those stages to get on top of this pandemic. So the company's been very active in that and in other areas of infectious diseases over the years. And we've been very active on the African continent for more than 12 years. And of course, we're seeing that our test kit being blood-based is gaining momentum due to the accuracy and the speed that we offer.
So active on the African continent, why have you decided now to open an office in South Africa?
We do see the need, especially after COVID, for people to have access to either self-test or point of care, so they can test in convenient locations or settings. And we do see that as a growing market at this moment. And of course, we're very passionate about this. And that's why we've opened offices there, because we do see that there's a huge need, not just for HIV, but for syphilis. We're busy with gonorrhea, chlamydia, hepatitis B. We've got hepatitis C out at the moment. And then our trichomoniasis will be coming out very soon this year as well. And we see that's a real need for it in the African market. And so we want to be sure that we position there to supply the support and that is required, and of course access to these medical test kits.
I think you've partly answered my next question, but the suite of products that you've outlined, those that you have and also the ones that are to come, how do they specifically aid the medical profession? Maybe address this answer directly at the doctors.
What happens is, if you look at our test kit, if you've ever tested with one of it, or you look at a video link that we have on our website, you can test in any location, if it's in the comfort of your home, in an office, a pharmacy, in a rural setting. We even have what they call community vans right across North America, and they can reach the people that doesn't have a permanent address or a location, that may be transient people. They can address all of it. It's straightforward. You sit down, you look at our test kit, you unwrap it. It's got a 3-stage approach to it because it is blood-based. And of course, you take sample 1, which is you add your blood, a 50 microliter free drop of blood, or with a pipette, if it's in a point of care. You add it into the bottle, shake it, put it into the BMU well. Of course, we've got a color enhancer and then a water diluent solution at the end, and you have your results. So typically it takes 1 minute. So why it will aid the doctors, it's the speed and the accuracy of identifying people in different stages of the disease that they have.
60 seconds, 1 minute is a very attractive proposition. Why has time then, Hans, become so critical when it comes to testing?
We've looked at a couple of years ago in Kenya, where they've used a test kit that typically will take a 15 to 20 minute window and hours. And we tested in a very rural setting, and typically with somebody sitting there monitoring the progress, and they actually have these buzzers on them, they could test 24 people in every 8 hours. With our test kit, we tested 480 people in the same time. So I think it becomes critical from the mass of people that you can test and separate those. Of course, as you can imagine, if 1% of them are infected and you're testing 24, you're really getting a small percentage on a daily basis. With our test kit, because it is so easy to use, and the speed, and of course the accuracy being 1 minute and a very high accuracy, you'll really get on top of those people that need the support to help, and of course additional medical care.
So you've spoken about the African continent. You've spoken about the presence in South Africa. What then, Hans, is the broad plan and focus for this important geographical region?
We'll keep on having a huge presence in Africa, definitely working in all avenues. At the moment, we're working very specifically with healthcare departments across various countries in Africa. And we feel that our big push is going to become in the private sector as well, with either Netcare or the pharmacy groups, so that you can have access a lot easier. We're trying to make access that any and every single person has access to it, and you don't go through a lot of tape to get to that point.
So you've mentioned the private sector and one of the big hospital groups that you would be engaging with. Who are the other important stakeholders that you need to reach out to? Who is on your horizon?
We're busy working with a lot of global funding partners, because we do understand there's a need for global funding partners to perhaps lessen the burden of the test kits and make it accessible to a much wider spectrum of people that need this care. And so we're actively working with them. We don't get subsidized, but we want to ensure that the parties or the governments there or the health departments can have access to these test kits and not pay the full financial burden, so that they actually get subsidized by the global funding partners.
And I'm assuming that the entire concept of rapid testing the world over is going to become more and more important given the different public health challenges that we now face.
Correct, Jeremy. So what we're seeing is a lot of the Centers for Disease Control is reaching out to us to get self-test widely approved right across the globe, actually. Because when we were facing COVID, everybody knew that how important it was to be isolated and how to get tested, especially if they had any of the symptoms above. And being in a setting with a lot of people at the same time actually was more problematic for most people, because you didn't want to be around people with 50 or 60 with them. And so self-testing, where you could just walk into your pharmacy or have a test kit delivered to your house, North America and Europe, we use Amazon very specifically for that. And we do see some form of that through the continent of Africa at some stage as well, so that you could actually have access to it and test yourself in the privacy of your home and actually know what your results is within a minute, and then get their healthcare via one of the many apps that will be available on the market.
I mean, I'm listening to you and I'm thinking this is a real game changer, isn't it?
It's definitely a game changer. We do find that putting your healthcare at your fingertips, especially with infectious diseases, is definitely going to be the future.
And the final question then, none of this would happen unless bioLytical had an enviable R&D capability. How are you positioned in that respect? And to what extent do you believe that gives you the leading edge?
We have a very active research and development. Everything that we research, development, and manufacturing happens in British Columbia, Richmond, British Columbia. So we're right at the port and at the airport for ease of sending test kits. We send them to 64 countries at this moment, right across the globe. We have 29 scientists working for us, working constantly, looking at all the variations, mutations from all diseases. And of course, we constantly work with the test kits that we currently have out on the market and looking at new infectious diseases. As I said, we actively work with the Center for Disease Controls in various countries across the globe at the moment. So we're exceptionally well positioned. We also control our supply chains so that raw material, very specifically prioritized raw material, is localized. So with other words, we set up additional factories, or we go into partnership with people in a very specific geographic area, so that we're never without the raw material that's required.
And that's where we are going to leave it. Hans Croukamp, bioLytical Laboratories Chief Operating Officer, thank you very much.
Thank you, Jeremy.